Accordingly, we have to understand your student and then give. The root of the spine, the lumbar. 1.
And knees will be supported here.
Knees supporting.
Inhale.
Up, up. 1. Pull. Yes. Shift back and then lean. Exhale. 1. 2. While leaning, don't pull up. 3. Give me more further down. 4. 5. 6. 7. Inhaling, come back. Exhale for loosening the hand. Yeah.
Side to side.
Yes. So, sideways and spinal extension done. Okay. Now, what is the next? Twist. Twist. Twist I have already taught, right? Okay, come, sit. Open hands sideways. Breathe in, breathe out. Cactus hand, breathe in, breathe out, breathing in. Now, I will give the twist. My right hand is going inside, yes, and my left hand on the shoulder, and start I am giving the twist. 1. Now, my this leg, the left leg is coming outer knee. Ekam, dve, take the hand down, left hand down. Trini, exhaling. Lock the hand, wrap the hand. With this elbow, you can support the elbow of the student. Breathing in, breathe out. Breathing in, breathe out. Inhale and come back. After this first twist, you have to relax the spinal cord. Give me the hands. The root of the spine, the lumbar, both legs, pressing, extend the hand, and you don't lean back, you lift the chest. 1, 2, and you should have mat because otherwise you will slide because of this surface. 4, 5, 6, take the right leg up between the shoulder blades. 6, 7. Both the legs between the shoulder blade. Left in the center, right leg will come down. Push the left leg. Check if the students can lock the hands. What we are not doing? We are not doing this. ठीक है? We'll do the other side of the twist. Open both the hands wide apart. Exhale to cactus. There is another way to do it with the stick. Sir, lock your hand. Exhaling. One. 2, 3, inhale, 3, exhale, 4, inhale, 4, exhale, 5, 5. I'll just take the feedback from the student. You also have to take. Which twist you will choose? First,
Stick is easy.
no, for your experience.
For my experience, this is easy. Stick.
Stick one.
Because when you are doing without stick, your hand movements are there and you are moving continuously. But with a stick, the movement of you is very less. And which each exhale, we are twisting more. So the time, like initially, you are giving inhale, coming front, then exhale, twisting further. That is easy.
Okay.
Staying in one position and twisting more is harder.
Okay. So with my student, the second experience was more better. Maybe with your student, the first experience.
First was better because I felt the stick restricting my movement.
Okay.
And with every exhale, I could push myself and move back
Ha.
because my hands were free. But with stick, the stick is resisting me to push a little bit more and pain starts.
Correct. So every body will have a different limitations, okay, and accordingly we have to understand your student and then give. Yeah. One, 2, 3. So after first twist, I gave the spinal relaxation, and after the second twist, what I am giving? The extension. Yeah. Lift the head. So it's like this. Shift the weight back. Here itself, you will start with a twist, since I have added this, which is right side is this, right? Yeah. First I'll do the left, you people do the right. So your left hand will come down. Sir, left hand let come down and get this head between this arm, and left elbow has to go down on the floor. So twist is working. So we need to support the student's back for twist and opening. Maybe we need to shift the place of the stick. Is this working now? Yeah. So see, I have added one hand here and my leg is supported from the back. I am lifting this elbow upward. At the same time, I am also pushing the shoulder blade inside. Also, I am working with this stick. I am moving this stick slightly away. Yeah. Inhaling, coming back. Take a stick up, both the hands, stick up. So, you have taught the extension. Allow the students to do the extension by itself and see that the student is doing good or not.